Hi, it's Dr. Z with Health City. Thank you so much for your interest in the medical marijuana card. After our appointment today, either in person or our televisit, you will receive what we call the physician certificate. This is your official form or doctor's note that will serve as your temporary card and serve as legal protection. Maybe you thought, why should I get the medical marijuana card in Missouri? I'm not a consumer. I'm not sure if this will help me. I want to encourage you or educate you about plant medicine and natural medicine. I started Radiance Float and Wellness about 2 years ago after being, jaded by the conventional system, which provides synthetic nutrients, band-aids, and don't get to the underlying problem. I am a big believer of Hippocrates, the father of medicine. Let food be thy medicine and medicine be thy food, and which really points to nutrient medicine. Our bodies have a remarkable way to heal itself when given the nutrients we need. With cannabis medicine, we can balance our systems, and by using holistic IV nutrient therapy, float therapy, cryotherapy, we can incorporate a lifestyle around cannabis and improve our quality of life. The law in Missouri, the medical marijuana law in Missouri, passed with 66% success in the last fall. As of December 6th, 2018, medical marijuana is legal in the state. To qualify for the medical marijuana card, it's what they call wide open. There are multiple categories like any chronic pain, any psychiatric disorder when diagnosed by a psychiatrist, when medical marijuana is safer than the current prescription, and any other chronic condition in the professional opinion of the physician. So as long as you have a doctor who will certify you for the medical marijuana card, you will qualify. The problem is all doctors are taught it's a drug of abuse, that there's no medicinal value, that it's Schedule I, and no research can be done. So it does take a doctor to go out of their way to learn about cannabis medicine and believe in it to recommend it. Dr. Z with Health City did just that. The endocannabinoid system is a remarkable system that every vertebral body has. Dogs, cats, and humans have receptors that go up and down the brain and spinal cord that interact specifically with THC, CBD, and CBN to regulate homeostasis or balance in the body. When we are not able to regulate balance in the body, the rates of chronic disease, mental health, cancer have risen. Before the Prohibition, cannabis medicine was the #1 prescribed medicine in the 1800s and early 1900s. In 1937, cannabis and hemp were put on prohibition and therefore wiped from our food group or wiped from our diet. The Prohibition led to big pharmaceuticals to come out with one pill for every ill or multiple pills to treat the various illnesses that cannabis can treat. So while you can qualify for pain, anxiety, cancer, you can use cannabis medicine for all these ailments. And the law in Missouri allows you to purchase 4 ounces of medical marijuana a month. So I encourage people to purchase small amounts of multiple different strains and experiment with their use and mode of ingestion and how they improve symptom control. The cannabis plant is made up of phytocannabinoids. Most people know of THC, which is psychoactive or causes people to get high. However, there's multiple other cannabinoids in the plant, including CBD, CBG, CBC, and they all have different healing properties without psychoactive properties. When you use the whole plant, you get what they call an entourage effect with maximum healing abilities. For instance, CBD can help decrease inflammation while THC helps pain. And THC can shrink tumor cells and CBD can prevent metastasis. As you see, these all work together best. The other thing that dictates the onset of action and duration of action is how you ingest it. Most people know about smoking. While that may not be medically recommended, it does cause a lot of combusted material and irritants. Vaping provides a nice alternative. The benefit is you get immediate effect. So for anxiety attacks, asthma attacks, pain, a seizure, it's nice to have something that works immediately. You also are able to release the terpenes and CBD and THC instead of burning them off. However, vaping does not last very long, and you'll have to frequently redose unless you use a different method with a longer duration. A sublingual is a oil or tincture that you put under the tongue. It takes about 20 minutes to absorb, but is known to have about a 4-hour duration. An edible, where something that you would swallow and digest in your stomach and process through your liver, will take about a 2-hour onset, but may last about 8 hours. So it would be good for pain or all-day coverage for anxiety or some other ailments that needed long duration. Topical is also a nice way to take a medicine. It is great for local effect. It can get rid of a migraine, a knee pain, or back pain. And our skin is our largest organ, and we can absorb things through our skin for maximum healing as well. The cannabis plant is only about 20% cannabinoids. The rest of the plant are what they call terpenes. And terpenes are the flavor or aroma of the plant and can offer other symptom relief. I like to look at charts that describe different terpenes and what their properties may be. For instance, if you're looking for something with an antidepressant property and to help you sleep, you may look with a strain with high linalool content. And then when you look at a chart of linalool, it's a terpene that has anti-cancer, antidepressant, anti-inflammatory, anti-seizure, pain relief, and sleep relief. And strains include Blueberry Kush, Skywalker OG, Amnesia Haze. So that way you can tailor make your medicine into what you're trying to target with your symptoms. So now that we've learned a little bit about cannabis medicine, I want to talk about the physician certificate form. This form is official form from the state that the doctor does complete. The top 3 lines are the only patient information that needs to be divulged to the state. The rest of the information is kept in my HIPAA compliant electronic medical record, and it is only for between the patient and the doctor. The information below this top part is all my information. This is my license information. This is that I qualified you under my name because I am a psychiatrist. I also am a child psychiatrist, and the state of Missouri has no age limit, and any psychiatric disorder qualifies. I don't need to qualify you under any particular diagnosis. We are just having a conversation that cannabis medicine could be right for you. The standard dose is 4 ounces of medical marijuana a month, or the law allows you to grow your own medicine and allows you to have 6 flowering plants, 6 non-flowering plants, and 6 clones in a locked room for your personal consumption. The second page is that we talked about the safety and other concerns. There is nothing under the law that allows you to consume medical marijuana and drive or operate other heavy machinery. We have discussed the risk of medical marijuana, especially as pertaining to breastfeeding infants. The other risk of medical marijuana is usually when there's an excess of THC, and so those can be combated with counteracting with CBD. CBD can help an uncomfortable feeling and can bring down the high. With this form, this does serve legal protection, so carry this with your medicine at all times. You are legally allowed to purchase and consume medicine for your ailments. The next step in this process is to officially register with the state. I went through this past process, and this is the official form that you get back. You will have to go to the state website, which is medicalmarijuana.mo.gov, and upload all your information, which includes your physician certificate, your photo ID, your state fee, and your license information or your address information if you intend to grow. As you can see on the official card, you are only registered with the state, your name and date of birth, and this official card is valid for a year from the date of issue. There is no diagnosis or doctor listed on the card, and this maintains complete privacy.